Don Dean, Chair of the Cabonne Health Council. Now, the Cabonne Health Council is made up of 6 or 7 small communities, so that we're doing pretty well in some, and some we're not doing so well in. And my question is, we were promised by the previous government, which I don't hold Jillian responsible for, but our previous government promised us a new hospital if we would surrender our old one. We surrendered the old one, and so they then gave us half of a hospital consisting of the stage 1. Stage 2 never happened. Stage 2 never happened, and my question is, why didn't it happen? And the present government cannot be held responsible for that, but we were promised, we were allocated the money, $4.5 million. 1.8 million was spent on which turned out to be a community health centre. Now, we're still not happy. We were promised our 10-bed facility. We want it.
So we might ask, who would I take that, on what stage you're at with that?
Yes, as you know, Don, I mean, you do have the services of a GP, Dr. Zambo, who comes out to Kudal from, and he also comes to Molong now 3 days a week. I think the models of care have altered over the intervening years, and it's not so much about beds as about services. And what we are trying to do through Health One in Molong is to have an integrated service with integrated records between Yeovil and Molong, probably Manildra in the future, and Kudal, where the inhabitants of those villages will be able to access doctors in all those villages, and their records will be linked. We obviously want to try and to bring more outreach services to those communities, and that's something that we would like to see expand from the community perspective. But it's not so much about the facilities, it's not about the bricks and mortars, it's about the services that you provide. I mean, people talk to me about Molong Hospital, and in the old days they used to do major surgery there and tonsils and everything like that. The world has moved on from that situation. I personally would never want to be operated on in a facility like that, because state-of-the-art stuff is in Orange. I think that what we've got to try and do is look at a different model of care, not based around beds, but about services. And I think that's what's important. And certainly the people of Kudal are well serviced by Dr. Zambo. And that's something that we would be looking to continue.
Look, I agree that the medical services are good. Dr. Zambo is well thought of and well received into the community. But we got a $1.8 million health centre, which is grossly underutilised. The services are diminishing. They're not improving, they're diminishing, and which we're not very happy about. And you can see a notice on the door, centre closed today due to staff shortages. So without being, nitpicking or one town against the other, but that staff member that works at that centre has got a notice on the door, staff shortage, centre closed. But that staff member that usually works this facility pops over at Health One.
Yeah, I think again the allocation of resources is something that we need to look at. I'm quite happy to have this discussion with the health manager for Cabon to see if more services are needed. Certainly, I'm happy to look into that personally, because I think it's important that we try and provide services as close as possible to where people live, and I'm more than happy to look into that personally.
Thank you for that. But that's the other part of the what I was going to say is that, as I said, the services are diminishing, and one centre is being used to wipe up the other. Like notice on the door, centre closed today because of staff shortage, but that staff member is in another facility. Well, why is it that staff member's got to go to another facility? Why can't it stop in the facility it belongs to?
Well, you might get that discussion there with Robin, because he's involved in the health delivery in that area. So he has both sort of a personal as well as a district hat that he can wear and discuss that with you.
Yes, but
Thank you.
We haven't let up on the completion of our facility. Stage 1's there, we want stage 2. And we haven't let up on that. I've been talking to Andrew G, and we'll be pursuing that one rigorously.
Okay, thank you.